We're supposed to be going back in September. That's gonna be good. The old man. Come on.
Thank you so much for joining us, the Eko Club Philadelphia, the program of our health education. I would like to welcome our speaker for today, Dr. Amna Karim. Thank you for joining us, Dr. Karim. Before we started, I'm just going to read a little bio about you. And also, after that, you can continue with the lecture. Thank you so much. Dr. Amna Karim is a family medicine trained doctor who has been practicing hospitality medicine for 7 years. Dr. Karim will be discussing the importance of good nutrition and exercise in disease prevention. She will also be discussing the importance cancer screening guidelines. Thank you so much, Dr. Karim. And I know you have so lengthy resume, but you just try to give us a little short bio about yourself. We really welcome you to Eko Club Philadelphia for this wonderful seminar. Thank you, and the floor is yours. Thank you.
Thank you. Thank you for that introduction. Yes, my name is Amna Karim. I have been in practice for 7 years as a hospitalist physician in Central Jersey. Now, what that means, being a hospitalist physician means that I take care of patients who are admitted to the hospital for acute medical problems. Majority of these acute medical problems are a result of chronic underlying medical problems. For example, diabetes, high blood pressure, coronary artery disease. These are all examples of chronic medical problems. In the hospital, majority of the times, patients are admitted for an exacerbation of an underlying chronic medical problem. For example, you can be admitted for a severe diabetic foot infection or a heart attack or a stroke from high blood pressure. So this is what I see in the hospital. My focus on today's presentation, however, is more on prevention of these chronic medical problems. Like mentioned, I will be discussing diet, exercise, and screening guidelines for prevalent cancers. Just bear with me. So let's start by talking about why this is important and a bigger picture. So USA has the highest GDP in the top 10 nations in the world. However, US also has the lowest life expectancy from these top 10 nations. You can see in this chart that United States life expectancy is about 78.4 years. Compared to Canada, our neighbor is 82 years, Japan is 84 years, UK is 81 years. So this disparity is due to chronic medical conditions and lower access to care compared to other nations. We as Americans have the most expensive healthcare system in the world. So the number one cause of death in America is heart disease. The number two, excuse me? I'm sorry, I thought somebody had a question. If you have questions, feel free to chime in. I don't mind stopping in the middle, or we can wait till the end, however, you want to do it. So getting back to this slide, the number one cause of death is heart disease. The number two is cancer. Number four is stroke. Risk factors for heart disease include high blood pressure, high cholesterol, diabetes, obesity, diets that are rich in trans fats, saturated fats, cholesterol, a sedentary lifestyle, tobacco, alcohol. Risk factors that you cannot control are genetics, obviously, your gender, your race, and your ethnicity. The top four risk factors that were mentioned make up what's called metabolic syndrome. So high blood pressure, high cholesterol, insulin resistance, and obesity. Now, let's shift focus to the more microscopic level of how the damage occurs in heart disease. You need two things. So you need cholesterol deposit and endothelial damage, which is the inner lining of the blood vessels that get damaged. Atherosclerosis develops with cholesterol depositing on the inside of the vessels. Over time, these become fibrosed, and inflammation and damage from long-standing diabetes, high blood pressure, smoking, stress cause damage to the inner lining of the blood vessels. So symptoms develop when the plaque or the deposit becomes too large for blood to pass through, or that plaque breaks off and goes to smaller blood vessels, causing inhibiting the blood flow to that part of the heart. So as you can see, it is very important to target the cholesterol and prevent the damage to the inner lining of the blood vessels. If you recall, one of the risk factors that I mentioned for heart disease was diabetes and its precursor, insulin resistance. This picture describes the action of the hormone insulin. Now, normally insulin is released from the pancreas in response to glucose in the bloodstream. The insulin is a signal hormone for different parts of the body, like our liver cells, our muscle cells that are present in our arms or our thighs. It signals these cells to take up the glucose that is in our blood. When we have an excess amount, when we have an excess amount of fat in our diets, the cholesterol is taken up by the liver cells and the muscle cells. The cholesterol deposits damages the cell and specifically damages the receptor that binds insulin, making the insulin essentially ineffective for the cells to take up the glucose that is in the bloodstream. Over time, this eventually leads to damage to the pancreas, which inhibits insulin secretion. So let's say you've eaten a delicious lunch, your body has broken down the components of that lunch, and it releases the glucose into the bloodstream. Normally, insulin is sent by the pancreas as a signal for other cells in your body, like your liver cells and your muscle cells, to take up that glucose and use it for energy or store it away. If you have insulin resistance, you're not able to take up that glucose effectively. Over time, this hyperglycemic state damages the cells in your body, including the pancreas, from producing insulin effectively. So as you can see, the major risk factors for heart disease, stroke, and diabetes is the amount of cholesterol in your body and the elevated glucose level in your blood. Now, it is important to know that you are able to reduce the risk of heart disease by modifying these risk factors. If you see this table, it is basically modifying either your cholesterol, lifestyles, and causes a percentage of risk reduction for heart disease. For example, 50% decrease in your total cholesterol decreases the risk for heart disease by 50%. Decrease in your blood pressure reduces the risk for heart disease by 16% and 42% in stroke. If you look at the second to last, exercising 150 minutes or more of moderate to high intensity exercise reduces the risk for heart disease by 35 to 55%. That's a significant risk reduction. The one thing contributing to developing metabolic syndrome and heart disease is our diet. Now, diets vary based on socioeconomic status, ethnicities, lifestyles. A simple example of this is, for example, if somebody is working from home versus somebody who works in an office, their diets vary considerably. In general, our diets consist of large amount of processed foods, large intake of dairy and animal protein, and high intake of saturated and unsaturated fats. Diet is also one of the hardest things to change. It is a behavior we learn in infancy, and our genetics even play a role in our preferences. When starting off on this lifestyle change, it is important to increase the positive aspects of your diet. Whatever good you're doing, amplify it. It's also important to work hand in hand with a nutritionist whose scope of practice is diet. So trans fats and saturated fats increase our risk of developing heart disease and diabetes. They increase our LDL, which is our bad cholesterol, and lower our HDL, which is the good cholesterol. Saturated fats are found in animal-based foods such as beef, pork, poultry, full-fat dairy products such as butter, eggs, and tropical oils such as coconut and palm oils. They are usually solid at room temperature. Unsaturated fats are essential fats that our body cannot create but also needs, such as omega-6 or omega-3 fatty acids. They include things like liquid non-tropical oils such as canola oil, olive oil, soybean oil, low-fat or fat-free dairy products, skinless poultry or lean meat, beans, peas, lentils, or tofus, fatty fish like salmon, and nuts and seeds. So the dietary recommendation from the American College of Cardiology, American Heart Association, and American Diabetes Association calls for diets that are rich in fruits, vegetables, legumes, nuts, whole grains, and fish. All three organizations emphasize plant-based diets, so diets rich in vegetables, fruits, legumes, and whole grains. All these foods are low in saturated fats. They also emphasize proteins that are from seafood and fish and nuts and legumes, and minimizing processed meats and red meats. Their recommendation also is to replace saturated fats with unsaturated fats, which is what we talked about previously, and avoiding trans fats, which are like your junk food cholesterol. The dietary recommendation for sodium is less than 1,500 milligrams per day for people who have high blood pressure and 2,300 milligrams per day for everyone else. Of course, avoiding sugars and refined carbs. So remember, focus on the positives of your diet and give your body time to adjust to the new changes that you're making. Now, let's shift focus on exercise. If you recall, exercise also plays an important role in risk reduction. Moderate to high intensity exercise of 150 minutes per week reduces risk of heart disease by 35 to 55%. So independent of insulin, exercise helps with insulin resistance by directly telling your muscle cells to take up the glucose that is in your bloodstream and store it away or use it for energy. The other thing is exercise also makes insulin more sensitive for muscle cells a day or two after you exercise. So the importance of exercise as we age include reversal of age-related muscle loss, boosting bone density, enhancing mobility, and improving balance to reduce fall risk. So these are the benefits of exercising, especially as we age. So the important thing to remember is safety first. It is important to start slow and build up to prevent injuries and maintain consistency. An example of moderate intensity exercise is walking at a brisk pace where you can carry out a conversation, but you cannot sing a tune. So that's an example of moderate intensity. High intensity is walking fast enough or jogging where you cannot sing out a tune. You may start with 10 minutes a day and then build up to 30 minutes a day, 5 times a week, which is an example of working yourself up to 150 minutes per week of moderate intensity exercise. It's important to also focus on strength training as part of your exercise regimen. Strength training to maintain and building muscle mass. So examples of this is obviously weightlifting. As we lift, as we age, our muscle mass goes down, putting us at risk for fractures and over time, loss of independence. Remember, exercise also promotes balance training. You can also include activities such as dancing, yoga, Pilates. Balance training helps prevent falls and maintains mobility as we age. In the middle of all this, remember to include stretching and which improves flexibility and prevents muscle injury and maintains mobility. Remember, start slow and build up. Whether it is dietary change or starting to exercise, you have to give your body time to adjust to it. Your goal is long-term achievement and not a short-term gain. Do you guys have any questions about this part? Because we're going to shift focus to cancer screening guidelines now. Okay, so if you recall, cancer is the second leading cause of death in America. So these guidelines are for average risk individuals. It is important to discuss these guidelines with your doctor or healthcare provider. Now, the two leading organizations for cancer screening guidelines is the United States Preventive Task Force and the American Cancer Society. Most common type of cancer that is diagnosed is breast cancer. However, lung cancer remains the leading cause of cancer-related death in both men and women. The most common type of cancer diagnosed in men is prostate cancer, and the most common type of cancer diagnosed in women is breast cancer. So the first type of cancer that we're going to talk about is lung cancer. Lung cancer is the second most common cause of cancer diagnosed. However, this is the leading cause of cancer-related death in both men and women. Age and smoking history are used to determine this screening eligibility. So smoking accounts for about 90% of all lung cancer cases that are diagnosed. The screening recommendation is for people who are between the ages of 50 to 80 who have 20-year smoking history. Now, smoking 20 pack per year smoking history, the way that you calculate that is that if you smoke 1 pack per day times 20 years, that's a 20 pack per year smoking history. If you smoke half a pack per day and you smoke for about 40 years, that's a 20 pack per year smoking history. So that kind of gives you an example of how much you need to be smoking. This is also for current smokers who do smoke. This recommendation is not for people who are symptomatic. For example, if you... I'm not sure if that's...
Yeah, I'm really sorry,
I'm
Dr.
sorry.
Yeah.
Oh, that's okay. I thought that was a question. Okay, so the recommendation is for people between 50 to 80 years of age who have a 20 pack per year smoking history, not for patients who are symptomatic, like persistent cough, weight loss, for example, coughing up blood. Those are symptomatic and those need to be screened a little bit more aggressively. The screening modality is by a low dose CAT scan that is done annually. Next type of cancer screening we're going to talk about is breast cancer screening. This is the most prevalent cancer that's diagnosed. So the screening guidelines vary based upon the age. These screening guidelines are for patients who are average risk. Anybody that is higher risk, the screening guidelines, which I will mention, are a little bit more thorough. For average risk women, meaning no personal history of breast cancer, no strong family history of breast cancer, no genetic mutation, and no chest radiation therapy before the age of 30. Those are all things that put you at higher risk for breast cancer. So for average risk women who do not have the things that I mentioned, between the ages of 40 to 44, there is an optional annual mammogram that you can get. For the next decade, 45 to 54, annual mammogram is recommended. For women over the age of 55, the recommendation is to transition to a mammogram every 2 years or continue annually. And for the higher risk women, the recommendation is to start screening at the age of 30 with an annual mammogram and a breast MRI. The United States Preventive Task Force recommendations for breast cancer screening are for women between the ages of 40 to 74 who are at average risk to get a mammogram every 2 years. So the recommendations slightly vary, but again, this is a discussion that you will have with your healthcare provider and come up with a plan for screening throughout your life. So for men, usually who are at average risk, screening is not recommended. However, if you're a high risk male, meaning you have a known genetic mutation or a strong family history, the recommendation is to start screening with an annual mammogram at the age of 50. The next type of cancer we're going to talk about is colorectal cancer screening. This is the third leading cause of cancer in both men and women. The screening recommendation is for asymptomatic adults age 45 and older who are at average risk for colorectal cancer. So average risk for colorectal cancer means no prior diagnosis of colorectal cancer or adenomatous polyps or inflammatory bowel disease, no personal history or no family history of known genetic disorder that increases your risk of getting colorectal cancer. So the colon cancer screening is recommended for average risk adults starting at the age of 45, and there's a couple of tests that are available. The gold standard is a colonoscopy, which is done every 10 years. This is diagnostic and therapeutic, meaning if they find a polyp, they can always remove it during the procedure. It's done every 10 years if it is normal. Otherwise, they'll tell you how often to get that screening test done. Other options include stool-based testing, such as a fecal occult blood testing that looks for blood in your stool, stool DNA testing, such as the Cologuard, which a lot of us are familiar with, or virtual colonoscopies, which are done every 5 years. So again, the recommendation is to start at the age of 45, and the frequency varies based upon which you get. Test, stool DNA testing, these CT colonography are abnormal. The gold standard, again, is to do a colonoscopy. One of the big questions is, when can I stop getting my colonoscopies? So routine screening should be stopped at the age of 75 for average risk individuals with adequate prior screening, meaning you've had negative tests previously. Between the ages of 76 to 85, screening is individualized based upon prior screening, comorbidities, your life expectancy, and what you prefer. After the age of 85, screening is not recommended. So let's talk about prostate cancer screening. This is quite a heavy slide, so I'm going to try to summarize as much as I can. So prostate cancer screening, there are 3 organizations that make recommendations. Of course, the United States Preventive Task Force, American Cancer Society and American Urological Association. The important thing to remember about prostate cancer screening is you have to have a discussion with your provider. A lot of the times, the gold standard for prostate cancer screening is a blood test called prostate-specific antigen, PSA testing. A lot of times PSA is abnormal, which leads to unnecessary testing that can have a lot of side effects. So this is a discussion that you have with your provider after you get, if you are interested in the screening. So the United States Preventive Task Force recommends that men between the ages of 55 to 69 have screening after discussion with their provider. Over the age of 70, screening is not recommended, and this organization did not make any recommendations on how frequently you should get this done. The American Cancer Society recommends for average risk men start screening at the age of 50 with a PSA blood test. At the age of 45, if you're high risk, meaning you have a first degree relative diagnosed with prostate cancer before the age of 65, or you are a Black man, so those are high risk individuals. For very, very high risk, meaning you've had multiple family members with prostate cancer, the recommendation is to start screening at the age of 40. And screening should stop when the life expectancy for a person is less than 10 years. The American Urological Association recommends screening for men between the ages of 55 to 69 with PSA testing every 2 to 4 years, and earlier for high-risk individuals, starting at the age of 40 to 45. And routine screening is not recommended by American Urological Association after the age of 70, or after you've had a discussion with your healthcare provider and they recommend not to screen anymore. The last type of cancer screening that I'm going to talk about is cervical cancer screening. So cervical cancer screening is also a little bit confusing because it varies based upon your age range. So under the age of 21 years, screening is not recommended. Between the ages of 21 to 29, screening is recommended by getting a pap smear every 3 years. Between the ages of 30 to 65, there are 3 options available for screening. The preferred option is doing HPV testing every 5 years. An alternative to this is co-testing with HPV and a pap smear, again, every 5 years. And the alternative to that is getting a pap smear every 3 years. If you've had adequate prior screening after the age of 65, meaning the past 10 years have been normal results, and you are not high risk, then you can stop screening. Some special considerations for cervical cancer screening that I wanted to mention. People vaccinated against HPV should still follow the same screening guidelines. If you've had a hysterectomy, and if the cervix was removed during the hysterectomy and there is no history of high-grade precancerous lesions or cervical cancer, then screening is not recommended. Individuals with HIV or weakened immune system, or individuals who have been exposed to diethylstilbestrol, which was a hormone used many decades ago to prevent miscarriages. These patients require more frequent and specialized screening. And that's it. Do you have any questions, or if there's anything that I can clarify?
Good morning, doctor. Good afternoon, doctor.
Reduce diabetes and obesity. Okay. So the question that was written was, what does a balanced diet consist of? And does balanced diet reduce diabetes and obesity? So balanced diet basically means, you get your protein. So there's three types of molecules that our body needs: carbohydrates, proteins, and cholesterol. These are all things that our body needs. So balanced diet basically means you get a little bit of portion of everything. Now, yes, balanced diet does reduce diabetes and obesity if eaten in appropriate portions. Um, you know, like I said, you need your protein, you need your carbohydrates, and you need your cholesterol. So yes, the answer is yes. If whoever asked this could clarify what is the question, like what does it mean by a balanced diet?
Yes, the question I'm just trying to figure out exactly what is the balance there, because we have we are the African descendants, and we have a different type of country. Some are from Indian, some are from England, and then we have different kind of food. So those are the areas that I just wanted to mention into. Some people believe in vegetables and fruits and all those things, whereby in other part of the country, there's a heavy starch in their food. What is the portion? How do they align that? Because some people don't know the portion of what their intake, and they'll be creating a problem because it's already what they have already been established right from the youth. And then in order for them to control, it becomes a problem. So that's it, my question. Thank you.
Yes, that's a good question. Yes, you're right. Everybody has different types of diets, based upon where we were raised or how we were raised. Our diets vary. You're absolutely right. Like I mentioned before, diets that are rich in, the recommendation is that diets should be rich in plant-based foods, so high in vegetables, fruits, legumes, nuts. And protein intake should shift from, high fat protein, such as full fat dairy products or red meats or fatty poultry like chicken, to more seafood based foods. So this is a more harder change to implement in your life. Um, but these are the recommendations. So yes, it is important to maintain a balanced diet, however that may look with your culture. For example, my culture, we are very heavy on eating rice and breads. However, again, like I mentioned, amplifying the good that is already present in your diet. So we do eat a lot of vegetables. So I try to balance that by eating a lot more vegetables. So there's no strict recommendation that the plate should be cut in half should be protein, half should be this. The recommendation is to focus on getting your fruits, vegetables, and plant-based foods in, and to shift your focus from red meats, processed meats, to more low-fat meats like seafood if you're into that, low-fat chicken, and tofu if you're a vegetarian. That is the recommendation. I'm sorry, I'm not sure if I answered that question.
Thank you so.
How else can you test before the shock news that someone is in stage 4? So outside of the self-examination and yearly mammogram, how else can you test for breast cancer before the shocked news that someone is in stage 4? So for younger people who have more denser breast tissue, if you feel any lumps or bumps in during your self-examination, the recommendation is to follow with your provider and do a breast ultrasound. Breast ultrasound always augment mammograms, especially for women who have denser breast tissue. But the recommendation again is to get a yearly mammogram. And if you're on top of the yearly mammograms, any abnormality can be caught sooner and tested sooner.
Okay. Good afternoon, doctor.
Hi.
Hello.
Yes, I can hear you. Hello.
Yes, okay. My question is, if you had hysterectomy done and your cervix was not removed, do you still have to be screening?
Yes. Yes, the recommendation is to still follow the same guidelines for cervical cancer screening. If your cervix was not removed during the hysterectomy, the recommendation remains the same.
Okay, thank you.
You're welcome.
I think the line is open for question now. If you have any question, you can type in your question, or you can raise up your hand, or you can just unmute yourself and ask Dr. Karim any question. Thank you.
Hello.
Hi.
If I have bloated tummy, what can I do?
I'm sorry, can you repeat that?
Bloated tummy, what can I do?
I'm not sure. Can you repeat that? I'm not catching what
I
that.
have bloated tummy, bloated tummy. What can I do for bloated tummy? My tummy is big.
Like you have central, like you have a bigger belly, like a bigger central area?
Yes,
Okay.
yes, yes, yes.
So overall, so people who have a higher waist circumference size are at an increased risk of heart disease and metabolic syndrome. So this is a very good question, actually. Waist circumference actually correlates to your, risk for heart disease. So the number one thing that you can do is diet changes. Again, what I mentioned previously, work with a nutritionist, get your diet under control. Um, the exercise would be the second thing that you can add. Now, a lot of the times we make mistakes, and I used to do this as well, is with a bigger belly, we focus on doing abdominal exercises. That is not the recommendation. The recommendation is to do a full body exercise to reduce the overall weight. So, what my recommendation would be to see your provider, get a referral to a nutritionist, and work on your diet to go into a calorie deficit diet and slowly start adding on exercise into your regimen as well. That would be my recommendation. Does that answer your question?
Thank you.
The question is, does obesity contribute to breast cancer? Yes, there is a link between obesity and breast cancer. So that's another reason to, focus on diet and exercise. You're welcome.
The line is still open for any question regarding to today's topic. If you have any question, you can unmute yourself and ask question, please. Yeah, you mentioned something about lung cancer.
I have a question.
Okay, go ahead.
My question is, what is the relationship between prostate cancer and either lack of sex or frequent sexual activity?
I'm not sure. I think that is a question that should be addressed to a urologist. I'm not sure about that.
No, because there is a myth that the more sexual active you are, the less your probability of having prostate cancer. And there's been a lot of, male clients always ask those questions. If I increase my sexual activity, will I have less chances of getting prostate cancer?
That's a good question. I actually don't know the answer to that question. But I can definitely look that up. I don't know the correlation between, so like I understand where you're coming from, but I do not know the correlation between sexual activity and your risk reduction for prostate cancer. I'm sorry, I'm not able to answer that.
No problem. I'm just asking. Thank you.
So between 2 and 3 would be a normal level. Like less than 3 is a normal PSA level.
Hmm? Yeah. Thank you.
Thank you so much, Dr. Karim. Is there
You're welcome.
any of your direct numbers or the hospital number in case most of our guests here today might want to just consult you, or is there anyone who can get in touch with you,
Like a direct contact number?
or to your hospital or to your department?
Yes, so like I don't have a direct number because we practice as hospitalists. So the way that my schedule works is I work 1 week on, 1 week off at the hospital. So I'm not an outpatient physician. I can always give you the name and the number for our department. However, that would just spin you guys in circles and not actually get in touch with a healthcare provider. So we work at Capitol Health in Trenton as well as Hopewell. We are a 30 doctor group, 30 people doctor group, and whoever is working on that week would be the person that you would get in touch with. So do you want me to provide you my contact number for the hospital?
Yes, that would be great.
Okay, I can write it in the group chat if that's okay.
Sure.
Okay. Are there any other questions? I'm just pulling up the number. No.
I have a question.
Yes.
Yeah, this my name is Raymond Lange.
Mhm.
Yes, you mentioned something about when you reach such an age, you don't have to be screened for prostate cancer. Okay,
Yes.
how about your PSA is way, I mean, you've done the screening
Mhm.
and then still your PSA still is still higher, it's like about 11 point.
Okay.
And then now you are 70 plus, and you said
Yeah.
when you reach the age of 70, you don't have to do any screening. I
So,
mean, do you still have to do it even though your PSA is still like way up?
so the PSA, when greater than 5 would be what triggers more testing. So for PSA, right? If your PSA is high, even if you've hit 70, the recommendation would be to follow up with a urologist for more testing. More testing includes doing a cystoscopy, doing biopsies. So if you are 70 and let's say your last screening showed that the PSA was like around 11, and then you do another test the year after and it's creeping up, like it's going to 12, 15, the recommendation is to follow up with a urologist and to do further testing. So at that point, it's not screening anymore. At that point, you would have to investigate further.
Oh, okay. All right. Thank you.
Yep. The problem with PSA, the reason why you have to discuss it with your doctor is depending on which way it trends triggers more testing. Unless it is off the chart high, like greater than 5, like let's say it is 11 for your first screening testing, that triggers more testing. A lot of the times, PSA is in this mid-range between like 3 to 5, where it's slightly elevated. You don't really know what to make of it. So that's why it's important to have a discussion with your provider. As men age, your prostate enlarges. That's called benign prostatic hypertrophy, BPH, like benign enlargement of the prostate, which leads to the PSA going up anyways. So it's important to take the full picture. Like the question that you asked is a very detailed question. I'm not sure about the full medical history. If you've been dealing with this for quite some years, like you've had a PSA of 11 for like, let's say the last decade, then you don't require more testing. But if this PSA of 11 just came up in the last 1 or 2 years, this triggers more testing. Do you see what I mean?
Yeah, I got you.
Okay.
Thank you so much, Dr. Karim. I know most members might have a lot of questions, but at this point in time, I don't see anything here. But we still have a line open. Hopefully, our program for today is from 12 o'clock to 1 o'clock. And I really thank you so much for the insightful information. Very thorough. You went through from nutrition to exercise and the screening. I would say that is 3 in 1. So thank you so much. I really appreciate you a lot. Thank you for coming on. Hopefully we will get back to you again and invariably very soon. We do this normally every other month or every month. It depends on the topic that we do have. We have series of program coming in from prostate. Different doctor will come online with us and give us some of this vital information. And I'm appealing to most of the members online. If you have anything that in any medical area that you want us to discuss or to talk about, you have our email address, you have all the information, please let us know. Not only that do we do, also we will be coming up again with different topic on different area from real estate, as well for AI and so many other topics in order to give our community, our area, our members this insightful information. We really appreciate you, Dr. Karim. You are wonderful. We will call upon you again. Thank you so much.
You're welcome. And thank you for having me. Take care. Bye.
Thank you.
Bye.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.